Thank you for listening to the Mental Health Survival Guide on North Volume Network.
Mental health needs a great deal of attention. It's the final taboo, and it needs to be faced and dealt with. Those are the spoken words of the rock star Adam Ant, and I definitely agree that he is right. At the Mental Health Survival Guide, we believe that some of our best tools for survival are information and resources. So today, we are going to talk about some neat resources for information. mentalhealthamerica.net and the ongoing projects that they have to measure the state of mental health here in America. And joining me in the North Volume Studios is a good friend of mine, Bonnie Black. Say hi.
Hi.
Now, Bonnie, before we jump into our topic,
Yeah.
please tell us a little bit about yourself.
Well, I came up here a number of decades ago to go to college and fell in love with the area
Oh, that's great.
and decided I was not going back to Long Island. I liked the pace here. I liked the idea that if you live 10 miles out of town, it took you 10 minutes to get somewhere.
Oh, that appealed to you.
Oh, it did, because I
Okay.
lived 22 miles east of Manhattan, and it was always an hour and a half to 2.5
Oh,
hours
okay.
in.
That makes sense. Wow. Okay. All right.
Yeah, so it's like, this is really neat. Plus the lake, the mountains, the whole 10 yards.
Yeah.
And I got a job.
That's great.
And isn't the whole point of going to college to get
Yeah.
a job?
Well, so what do you do around here in the North Country?
Well, I hang out at BHSN a lot,
Ah.
Behavioral Health Services North, and I run a
I've
couple
heard of them.
programs. Yeah.
They're pretty great.
One of the programs that I run is Employee Assistance Services. That's an EAP, the only EAP in the northeastern part of New York.
So what does that do?
What it does is it basically, we contract with organizations so that their staff can have free counseling whenever they need it. And if they have emergencies, we answer the phone 24/7. We provide a lot of trainings and workshops helping employers comply with state laws like the new New York State sexual harassment law,
Right.
where if you have one employee, you must provide annual training, things like that.
Yeah.
Yeah.
That's a good thing.
Yeah.
Yeah.
So we do that. And the other program that I run is a batterers program. It's called PACT, Personal Accountability for Changing Tomorrows. And the other program that I run, which got me integrated into mental health in this community, is the Mental Health Advocacy Program. And it is intentionally retaining the MHA because the organization that I initially began with was the Mental Health Association of Clinton County.
Right.
And we are part of Mahaney's Mental Health Association, New York State, and ergo, Mental Health what is now known as Mental Health America. It used to
Right.
be Mental Health Association, U.S.
Right.
Yeah.
And that's the organization we're going to kind of talk a little bit
Yes,
about today.
where my passion lives.
Right. Oh, actually, I didn't know that before I asked you to comment on that. That's interesting.
I found it really coincidental that you
Wow.
did.
It's like meant to be right there.
Yeah.
And also, Bonnie and I have worked together in suicide prevention and also just good old-fashioned mental health awareness.
Yes.
So our paths often cross, and it's always a pleasure to work with you on a project.
Thank you, sir.
Thank you for coming here.
Yeah.
So, so let's talk a little bit about Mental Health America. I'm going to just get you some information that's just pulled right from their website, and then maybe if you want, feel free to expand upon
Okay,
that, because
sure.
you might know. So according to their webpage, Mental Health America, MHA, was founded in 1909 and is the nation's leading community-based nonprofit dedicated to addressing the needs of those living with mental illness and promoting overall mental health for all Americans. Their work is driven by their commitment to promote mental health as a critical part of overall wellness, including prevention services for all, early identification and interventions for those at risk, integrated care services, and supports for those who need it, with recovery as the goal. Is that a good explanation of who they are?
Yes,
Okay.
and it's exactly what I loved about Mental Health Association Clinton County when I first joined it.
All right. Okay. So that explanation's interesting, but it doesn't kind of explain what they do. It you know what I mean? Like, yes,
Yeah.
it has the advocacy part, and yes,
Yeah.
it's all out there. But in doing the research of just trying to find out exactly how other people can get involved with them, they do everything. Like a lot of awareness raising campaigns are by MHA, but they're also constantly doing studies, and they are constantly tracking statistics with doctors, therapists, care managers, case managers. It's got to be an exhausting task, I would think.
They have become very broad, yet maintained their specialties, so to speak. I usually will talk to people, let's say, who call on the phone.
Right.
Okay, and we call that the information and referral phone call.
Sure.
Someone just wants information. They don't want to be seen, la-di-da. Maybe want to be seen after talking, but not right away.
Right.
Can you give me the phone number for? Can you give me,
Sure, yeah.
Well,
kind of the in-between, right?
Yeah. Like
Right.
my toes in the water, but not really.
Yeah. That's such an important part of recovery, though.
It
the
is
beginning,
that first, making the phone call.
Yeah.
That is where the strength begins.
Yeah, that's that contemplation to action step right
You
there.
got it.
So
You got
it's
it.
pretty great.
So sometimes I will direct a caller to, for their friend, to the Mental Health America website, because they have 5 or 6 different screening tools. You do it anonymously.
Yeah.
These are veritable
Right.
screenings. It's the same ones that we give, that therapists give if you come in face to face in many cases.
Yeah.
And you can take it, you can see the answer, and then the MHA website guides you to resources and also can connect you to wherever your zip code, if you're willing to give that up,
Right.
will connect you.
Yeah,
Yeah.
so local and national resources,
yes.
which is important.
Yes.
So just one of the explanations of what they do is they believe that gathering and providing up-to-date data and information about disparities that faced by individuals with mental health problems is a tool for change.
Exactly.
So that's got to be kind of a bummer part of the job when you're kind of just going, wow. Look at these states. This article that we're talking about, it actually ranks states.
Yes.
And to be in the bottom couple states, or to be people living in the bottom couple states, that seems discouraging.
Eeyore.
Right. But it's a good thing because it's a great way that other organizations can use that information and channel resources towards that area.
And make change. And that's part of what MHA is about, too. Making policy change, making veritable changes in day-to-day lives. Like with Mahaney's, the New York State
Right.
MHA.
Yeah.
I'm very connected with them. And one of the things that they spent years putting together data, looking at research, was mental health education in our public schools in New York State.
Oh, sure.
And it came to a real, yes, of course there's lobbying, because to make change, you have to change laws in many cases.
True. Yep.
May not want to, but
Right.
it's
It's
way.
unfortunate that it has to go that way, but
Right.
it that's the world we live in at the moment.
Yeah, if you don't tell me I have to do it, I can't fit it in.
Right. Exactly.
But that whole that started this year, that there must be mental health education included in public schools
Right.
for young people, just to begin the conversation. I think that's phenomenal, and that's some stuff
Yeah.
that MHA does. Like, let's talk about the subject.
Yeah, they're very much one of the forces behind that the concept that mental health is physical health.
Oh, yes.
And that mental health, a mental health epidemic affects everyone.
Exactly.
And that is really kind of cool, very punk rock, so that's why it always got me very interested.
Yeah.
So we're going to talk a little bit about those rankings I brought up earlier.
Sure.
So, and we're going to talk about how some states fall into the rankings and what are some things that we can do to maybe improve this overall ranking. So, without further ado, you can actually go ahead and go to mentalhealthamerica.net and find these rankings. This ranking system was started in 2015,
Yes.
and they update it every year. So the report for 2000 that says the 2019 report is actually the statistics that they gathered from 2015 through 2018. So just so you know. So we're going to chat just about the whole adult ranking.
Okay.
Oh, wait. No, let's go to the overall ranking. Now, the overall ranking measure, there's 15 measures that make up the overall ranking, and I'm not going to go over all of them, but they are very specific, but great ways that people have gathered data. So, number one, the state that ranks highest in overall ranking is Minnesota.
Yep.
Which is interesting because I don't ever think of a lot of things happening in Minnesota, right?
They're very content.
Which is great. Number 51, unfortunately, is Nevada. Now you might think, well, maybe sample size affects this. Well, no, it is skewed down. These are per capita. So
Right.
But I'm let's talk a little bit about what affects us, and that would be New York, and we're kind of just a stone throws away from Vermont. Vermont actually ranks number 5
Right.
for overall ranking. And
Overall.
Right. And New York ranks 12. And
That should make us feel good.
right, I mean, it's 12 out of 51.
Exactly.
So-
51 because of Washington, D.C.
DC,
being included
yep.
with the 50 states.
Right, exactly. So, okay. Or I'm okay with that. But once you get into the other rankings, we've got we got the adult ranking, and these are services for adults. Sometimes these are sometimes these involve a different set of categories necessarily. Like it's about insurance and it's about services in those areas. This whole list goes haywire because number 1 is Maine.
Yeah.
Number 1, Maine has the best, apparently, overall services for adults. And number 51 is Oregon, which I often...
That blew my mind.
Yeah. I'm just like, wow, okay, that's very interesting. And let's see, where do we rank?
12.
Again. But Vermont jumps all the way down to 23, which is very interesting.
Yes.
So, again... just note that there are a lot of these topics. There are these categories that this isn't ranking, and please go to the website and read all this report. But let's jump into the youth. Now, the youth ranking, number 1 is Minnesota.
Yeah.
Yeah, there you go.
Healthy young kids.
And number 51 is Nevada. Now, this mirrors the overall ranking. New York does a little better this time.
Yeah.
And that is, we're number 10. And Vermont is, where did you go, Vermont? Oh, number 2. Yeah. So there you go. And that's actually youth. And why that is important is, so I've done this research, and in my 38 years of life, I've come to realize that children actually grow up into being adults. Yes, once they hit a certain threshold of time. So you would think that should affect this. Now, prevalence. Now they have the prevalence of mental illness. They have a ranking. This one I found in kind of doing the research for this one. This one I was disappointed, and you would think that like Florida would rank number 1 just because Florida always has those like stories in the national news where someone does something really ridiculous, but it's New Jersey.
I know.
You know,
that blew my mind.
That's prevalence of mental illness, meaning people who are reporting themselves as mentally ill and receiving services.
Right, that New Jersey has the lowest prevalence.
Yep. New York is, staying strong right there
11.
At number 11. Vermont jumps down to 45 because, people are happy in Vermont and they don't really have a lot of problems apparently.
Well, what it means is there's more mental illness in
true.
Vermont.
So the one that I really do need, I think we should focus on, and that was the ranking for access to care.
Yes.
And that's really where change is going to happen. The people who rank top for access to care is Massachusetts.
Definitely.
Which makes sense to me because all of the great conventions and really awesome events for mental health seem to happen in Boston. So
Well, and they are very close to universal health care in their state.
oh yeah, that's true.
So what
Super
does
jealous.
this tell us?
Yeah, exactly.
If we had universal health care
Right.
across the United States,
That things would get better.
yes. Yeah.
Number 2 is Vermont. And New York jumped down to 17.
Yes.
Which still is really good
Yes, out of 51.
out of 51. But I can start to see some issues here. Number 51 was Mississippi, which I'm sure doesn't surprise some people out there. Texas was number 50, which I think is interesting because
Yeah.
I for some reason I feel like Texas is such an American country. Like a lot of the world, they think, oh, America, it's basically New York, California, and Texas. Yeah, so that represents, and I guess access to care is just not as important in Texas for the population, at least, which is unfortunate.
Well, I think if you look at the population concentrations in Texas, you have very few highly populated locations.
Right.
And rural is the bulk of it.
Yeah, it's a huge state.
That's it. You know, if you look at the square footage, so to speak, square
Yeah.
miles, there's more dust than people.
Yeah, that's true.
You know.
That's true. And what rankings, we can go over rankings and how they are important or maybe how wrong the data might be or how we found the data and how it just isn't working out the way we wanted it to. We could talk about that, but I don't want to focus on that because the data is what the data is. And if you look over their past, you can actually look over past rankings. There's definite change in that.
Yes.
So my thoughts are, what kind of information can we take? Actually, this is a question, not a thought, but what kind of good information do you think, Bonnie, that we could take from lists like this?
Well, it's a trend. You know, any
Sure.
point-in-time survey is a point-in-time survey, and it's no good once you've done it. It's history.
Right.
But when you look at a point-in-time survey that
Yep.
is replicated consistently, veritably,
Yep.
from year to year to year, now you can do viable comparisons.
Right.
And what MHA's been able to do is say, look, we have in the last 4 years the amount of American adults who have a mental health and or substance abuse problem has actually decreased, no matter what headlines say.
Right. Which is great.
Yeah. I mean, it's a fraction, but it's going down.
Yep.
But it is now also showing alarming increases in adult suicidal ideation. That's increased, and major depressive episodes in youth have substantially
Increased.
increased.
Yep.
Now, here comes the chicken egg question.
Right.
Are those major depressive episodes in youth dramatically increasing? Are they reaching out for care and they haven't before? Therefore, we have diagnoses in that age bracket which we haven't had before.
Yep.
You know, that's always like,
Yeah, I mean, it's a tough way to think about it, and I get stuck on that a little bit because resources for suicide prevention are more accessible today than they ever have been, and our culture is very saturated with a strong understanding of suicide, I think. I mean, it could get better. It obviously could always
yes,
get better.
It could get better.
But instead of it being the butt of a joke, often there have been a lot of groups that have tried to take a serious approach to suicide.
Yes.
Which is great. So are the numbers increasing because people are more aware of what the services that are out there, you know, where they didn't talk before? That, I mean, just you kind of chase your tail in kind of understanding this. But at the end of the day, it doesn't matter to me. That doesn't necessarily matter as much as like, is Jimmy getting the help that he wants and needs? If the
Yes.
answer is yes, then that's a win. That's a win on one end.
Exactly. And a lot like in the suicide prevention trainings that I do, just knowing the question to ask and knowing the follow-up to
Right.
that question is so, so important to allow someone to speak.
Yep.
Because they want to tell somebody.
Right. Exactly. Which is, we need to normalize the concept of being able to talk about mental health,
Yes.
suicide,
Yes.
all sorts of anything that you need. We need to talk about it. People talk about their cold
Right.
often. Let's talk about when you're not feeling great. So I'm just going to jump on in. I do this a lot during my podcast. I'm going to talk a little bit about there is the National Suicide Hotline, but there is the text line, which is 741-741. And you don't need to do anything. You just need to text them, and somebody will respond to you in a matter of minutes.
Yes.
And it's always a pleasant interaction every time that I've needed to use it for myself or with someone, or even just to show someone that this service exists. So that's 741-741. Then that's the number. Then you can just text hi or New York or whatever you want, and somebody will get back to you.
Conversation starts.
It's very cool. So
Yes, it is.
So about this report, they came up with a couple of bullet points for key information that I just kind of want to share, and that's one is over 44 million American adults have mental health conditions. This is as of end of 2018. Over 44 million American adults have a mental health condition. Since the release of the first State of Mental Health in America report in 2015. There have been only a slight decrease in the number of adults who have a mental health condition. So it goes from 18.19% to 18.07%, and I feel like, that's a good thing. Maybe that's a good thing. I don't really know. I also feel like that margin of error is too slim.
Exactly.
It's not. I don't think people should be celebrating at this point.
No, it's. I would look at it as it is static.
Right. But what I think is a big jump, or a bigger jump, is the rate of youth experiencing mental health conditions are on the rise. It jumps from 11.93 to 12.63. Now, that's not too small of a margin of error. I actually think that's interesting.
Yes.
But there was only a 1% decrease in the rate of youth with a major depressive episode who did receive treatment. Okay, so there was a decrease. The decrease is 1.5%.
Yeah.
Again, this is interesting because it kind of shows, I think, me that we are focusing on the right thing, but our youth are only youth for a little while. And we need to be able to get them the services that they need while they're young, so that they can work on it earlier in their life instead of developing major mental health issues as adults.
Right.
So,
but the data also showed that 62% of youth receive no treatment.
right. That bothered me.
Yeah.
And
it should.
And I feel like that happens all the time, whereas, someone says, hey, something's wrong with me. They go to get help, and then they get somebody saying, oh, no, you're fine, or there's nothing we can do for you.
Or do we go back to the access?
Right.
Youth are not mobile.
That's true.
They need an understanding adult to take them to the treatment, unless the treatment is accessible to the youth where they are,
Like
in schools.
remotely.
Well, or having school-based clinicians.
Yeah, that's a great way to connect. Yep.
Exactly, where the youth can actually receive services.
Yep.
Rather than go without.
Right. So there is a positive. More Americans are insured than ever, which is a good thing, right?
Yes.
We complain about insurance, and I agree that I think global or national, just good old-fashioned insurance to insure everyone, that would be wonderful.
Yep.
But what they call the Affordable Care Act, but also Obamacare, whatever, that actually led to some good things. More people got insurance. Some of them got insurance because they were afraid of the penalty they were facing. But hey, when you got that insurance and you're having a hard time, there's almost nothing else keeping you from going to seek help.
Right,
So,
you're more predisposed to access the
which
care.
is awesome.
Yeah, so I mean that healthcare reform has had a positive impact on mental health care.
Which is great. But unfortunately, with the rise of Americans with healthcare, they are now stating that about 1 in 5 or 9 million adults have reported having an unmet need.
Correct.
So that people are accessing their healthcare network, but something in their healthcare network is not adequate enough to service what they need.
Right.
And that is
And that's where we
disappointing.
get to talk about the integrated healthcare, where you may go because you're coughing or you have a fever, some physical health thing.
Yeah.
But in the discussion, if that provider believes there's something else underlying,
Right.
how you present, they'll be like, hey, I'm going to have you go 2 doors down and see our behavioral health specialist today.
Right.
Which
Which is good. I mean, I do complain every once in a while. Sometimes people do go to their doctors, and maybe it's not the doctor's fault, but every once in a while, sometimes there's this idea that if the one doctor that you see can't fix you, they're just like, oh, there's nothing we can do for you. There's no referral process going to someone else, that needs to change. That definitely needs to change.
And the idea of the integrated healthcare is the right step. So
Right.
if you're coming in for mental health services, you also have physical health, because we know prevalence of diabetes, hypertension
Absolutely.
is very high in adults with major depressive disorder and any serious mental illness. So if you're okay going to your behavioral health people, well, look, we've got a doc right here who
Right.
can work with your blood pressure, or vice versa. I'm going in, and
Yeah.
my stomach hurts, and da-da-da-da-da. Oh, how about a screening for anxiety? Let's
Sure.
do that over here.
Yeah, that needs to be handled carefully sometimes,
Oh,
because
yeah.
sometimes people complain about pain, that's real medical pain, and then
yeah.
a doctor has unfortunately said, you're just depressed. But there should never be a diagnosis of you're depressed. If you're depressed, there's a reason. There's a mental
Chemical.
It's
Yeah.
mental health, yes, but mental
Yeah.
health is physical health.
Exactly.
So we need to figure out the follow through. That needs to change, obviously.
Right.
Um,
right.
So
But we're moving there, and that's
we
what's
are.
important.
We are. We're heading in that direction, which is really great.
And I think that's part of why New York State looks good in some of this data this year, because as a state, we are looking at removing barriers,
Right.
getting people to appropriate treatment. The emergency room is not always the most appropriate place to be.
But is the place that people know about.
Exactly.
So that maybe needs to change also,
Right.
right?
Right. And what is delivered there.
Right.
Yeah.
So and actually here in Clinton County, we're working towards fixing that a little bit. We
Yes.
have systems where if people utilize the emergency room a certain amount of times, they can get a referral to programs that just send somebody and say, "Hey, how you doing? Is there something else we can do for you?" Which is
Exactly.
great because not only does that help that individual, but it saves the county money.
Yeah, and you don't have to worry about the hurdle of transportation
Right.
because that person is coming to your home.
Right. Or to anywhere.
Exactly.
Sometimes
Could be
it's
coming to the library.
yeah.
Could be coming to
sometimes
wherever.
it's a Walmart parking lot. Who knows?
Yeah.
The idea is that if you need help, you should be able to access it in some possible way.
Right.
And if somebody can bring you those steps, it's that much more sure that you're going to follow through. Or that's the idea, right?
And bouncing off of what you just said, there are now in some states some behavioral health clinics inside Walmart.
That's
It's true. They've
You know,
just started.
if I've ever needed a place for mental health, it would be Walmart because I always feel like I'm gonna lose it when I go there. But that's just me. That's personally me. But let's get back to our discussion.
But that's the accessibility to care.
It
if you
is.
think about it, I'm going to make sure I go do my grocery shopping at Walmart.
right.
Oh, by the way, I could also
No,
do
that's
my check-in for my mental health.
it blew my mind when Walmart started
Yeah.
to have eyeglasses places. I've seen some Walmarts online that have dentist offices.
Yes.
And I understand that. And I'm torn about Walmart because their global impact bugs me, and the Waltons just, as people, I'm not always in love with the idea. However, socially, Walmart does some pretty awesome things, and they've been there as far as supporting LGBTQ groups.
Yes.
Also supporting mental health, supporting just employment. And there are some places where the biggest employer is Walmart.
Yes.
And that's a pretty big deal. So the idea that they're expanding their services to meet the needs of the people who work there and also the people who shop there, that's a cool thing. We
It is
still need
very cool.
economic diversity. I agree we need economic diversity, but hey, Walmart's not going anywhere. Hopefully they're doing some good, right?
Right.
So in talking about that, because we do have a Walmart here in Plattsburgh, how do you feel like our area compares to the rest of New York as far as mental health services?
Well, we always have to remember that when we look at New York State, unless it specifically says excluding the 5 counties of New York City, they're included.
Which is the majority of the population, right? Isn't
The bodies in the least geographical.
spot.
Yes, exactly.
More people per area.
Yeah. So when you look at the rest of us in New York State, somebody in the Bronx or Staten Island might say, oh, my heavens, there's a therapist on every corner. That's true. The groups are like 8 or 10 practitioners in them.
Right.
True. Now, come to the rest of New York State.
Sure.
And real upstate New York, not below I-90.
Right.
Let's go to real upstate New York.
Yep.
Yes, we do have a lot of land, but we have people living in isolated pockets.
Yeah. Yeah.
Now, how do they receive services?
Yeah.
When a bus might come at 6:50 a.m. to bring you to Plattsburgh, let's say,
Yeah.
and then you can't get a bus to go home until 4:15 in the afternoon.
Right. And that does happen here.
Yes.
It's a pretty common issue, and my hats are always off to those who do that.
Oh, yeah.
Because
I'm not sure I'd have the patience.
prioritizing there are jobs that I haven't taken because I didn't want to commute that far.
Right.
But that's how it is. And when you're in a situation where that's the only thing you can get, you're gonna access that. But there are people
Hopefully.
out there who are not accessing that because it
Yes.
is not convenient enough for them. And I say that sounds demeaning, but I think convenience is obviously a part of our everyday lives.
We all look for the convenience.
Right.
It's open after 5 p.m. Well, I work till 5, so now I'll choose that place to go because it's convenient for
Right.
me on the way home.
Right.
Yeah.
So transportation is an issue.
Definitely.
Here.
Big
It's probably an
barrier.
issue pretty much everywhere, even including, the 5 boroughs down in New York City.
Well, every 10 minutes a bus will come by.
Sure. But relatively, I'm sure every area says transportation is an issue. But it is an issue. It's something that we deal with. What's another issue you think we deal with here? And
The big one?
yeah, let's talk about it.
Okay, stigma.
Yeah, absolutely.
Nothing wrong with me. Slam the door. I don't go out. I don't talk to anybody. I won't.
Do you think that's a North Country attitude?
No.
Or
No, I believe rural America, from data
Sure.
that we see,
Yeah.
that rural America has very similar problems and issues with access to
Sure.
care, with continuing care. And we look at specifically with Native Americans because they are already isolated geographically.
Yeah, and
we
they're
put them there.
they're
Us white
and
people.
they're kind of walled off too
Yeah,
as far
exactly.
as services.
Yeah. So how do we assure that there are services? For instance, in Akwesasne, there is great mental health services because they made a very concerted
Right.
effort in the 90s to have people from Akwesasne and the Mohawk tribe to actually get their college educations,
Yep.
get their master's degrees, come back to your culture, your heritage, and serve.
And provide
Yes.
services that are appropriate for that culture.
Exactly. For a while, I did some training in youth mental health first aid up there because that's usually delivered by two facilitators until they got a second person from the reservation trained in it. And, I felt fine not having,
Yeah.
I loved going there.
That's a
because
great problem to have, right?
It opened to me some diversity
Sure.
I did not know, which I bring into the youth mental health first aid trainings periodically when appropriate of, in other cultures,
Yeah.
right here.
And I've also had the pleasure of working with folks living on and off of the reservation, and it's interesting because I grew up around this area, and I thought I knew everything, or as far as like I kind of felt like I understood the cultures that were widely represented up here, but oh boy, it was a culture shock because there's stuff I was just like, wait, why are we doing this? Why does that person have to be here? Stuff I just didn't know. So that was a slap in the face, and it was good for me. So that is great that we do have on the reservation. We do have people who are
But
able to provide these.
That was a very concerted effort by that council.
Sure.
They wanted to be able to provide
Not New York State, not Clinton County. It was the reservation. It was those that entity providing for itself.
Exactly. And not that self-sufficiency is the goal, but it is how can we raise ourselves without doing it ourselves.
Sure. And it's actually a little well, chances are it's easier to work in smaller groups, which is great. But to kind of come back to our area and talk about some of the major problems, and you bring up stigma. I had a discussion with a gentleman the other day who, he was very adamant that guns should be banned. And I'm not a fan of firearms. I'm not an advocate. I've shot some guns. I think hunting is good if you're a responsible person. But our area, Clinton County and Essex County, has a high rate of gun-related suicide.
Yes.
But it's not the guns that are killing the people. It's the fact that these people are not accessing the services that are needed for them to get better.
Right.
So, because there are plenty of gun owners out there who can be responsible.
Oh yes.
I would think.
Yes.
So I feel like the whole issue is one of those things that we should talk about, because just because the mode of operation for suicide is very much guns in certain areas, that doesn't mean guns are the problem necessarily.
Right. And that it's males. The
Right.
choice of males.
Yeah.
Yeah.
And it doesn't mean it's men are the problem either.
No.
It's not necessarily. It just means that there are needs out there that are not being met.
Right.
How do we increase that? How do we so say I'm going to give you $1 bajillion, Bonnie, to fix this problem. What would be the first step on helping more people, improving this in this area?
Getting people to recognize when they need help.
Sure. So self.
Well, self. And then also being trained in looking at the other.
Sure.
Because you don't run around, for instance, you may have a certification that you could do CPR and use an AED. Well, we don't go around going, how's your heart? Are you breathing? Do you need CPR? Okay. Well, we don't go around going.
If you are, I'm ready.
Yeah, right. Yeah. Here I am. Need me now?
Right.
And it's the same thing in mental health. How you doing? Okay. You need to see somebody? Need to talk? I mean, no.
I mean, I've had plenty of trainings, but I don't walk around going, "Are you going to kill yourself?" Right. I don't start my conversations with everyone like that.
Exactly.
That'd be an interesting way to do that, but maybe lead to some other major issues.
Yeah, like nobody talks to Nick.
Nobody talks to Nick. That's probably a good idea anyway.
But, how do I recognize in myself? How do I recognize in other?
Sure.
And once I recognize, what do I say?
Right.
What do I do?
Good. Yeah, that's true. And again, that brings it back to stigma too. changing the culture slightly so that it's not seen, so that mental illness is not necessarily seen as a weakness, but more as a need.
Well, yeah.
People don't see hunger necessarily as a weakness. Some people might, but but if somebody's hungry,
You
and
feed them.
you feed them, right? So if somebody
Yeah.
is in need of mental health services, you should give them that. Right?
Exactly. And connect them to it. You don't have to provide it,
True.
but you need to know where to point somebody or take somebody
Yep.
for that care.
Yep. And as somebody who works in mental health recovery, I say that is the key part of existence up here, is having an idea of what you know and who to refer to. Mm-hmm. And if you don't know, you say, I don't know, but we can find out together.
Exactly.
And that does work. So we need to work on ourselves.
Yes.
But that comes from possibly changing the culture a little bit.
Yes.
Wouldn't you agree?
Oh, definitely.
Okay. Oh,
Definitely.
all right. Okay. So stigma is probably one of the biggest things that we're facing.
Yes. Yeah, and that's what helps create the disparities between people. Because
Right.
there are some people who are willing and able to educate themselves or do research or whatever, and then there are others are fearful
Sure.
because
Yeah.
of myths like if you talk about it, you'll catch it.
Right. Or that, something that I am constantly bombarded with, which is they don't want to seek services because they don't want to lose their kids.
Yes. The
Or
fear that is
there's that
connected
fear.
somehow. And the
And-
thing is, if you're receiving services and participating in services,
It always looks good.
yes, exactly.
does.
It's a positive check mark.
Yep. Yeah. Because, blowing up and having a meltdown in the middle of Target
Yeah.
is bad.
Yeah.
But going to your weekly or bi-weekly meeting with your therapist, that's a good thing. People shouldn't, we got to stop talking crap about people who are crazy, because you know what? We're all crazy, all right? Let's
Yeah.
just throw that out there.
Well, that goes to my pet peeve, which is
the word.
language.
Yeah, I understand.
Language matters, and we have to call ourselves when we hear things like, "Oh, it's been crazy today." No, it hasn't been crazy. It's been hectic.
Yeah, I'm actually working. The word crazy is on my list of words to work on for myself, and that was because I was using it too casual. And I'm not a word czar necessarily, but I do believe that the words we say and how casual we are do affect the culture that we live in.
Right.
So-
yeah, and if, let's say, I've finally gone to a provider and I've taken a screening, and yes, I am now diagnosed with an anxiety, and I'm now living with this diagnosis just newly in my life, to put this label on why I feel this way, and you start saying, "Oh, you're acting crazy."
Right.
Now, am I going to tell you I've just been diagnosed?
Right.
No.
Right. Or you know what happened when I was first diagnosed with an anxiety disorder? I found, and I don't think that this changed much, but I think my ability to notice it changed much was the amount of people saying, "Oh, I have anxiety. I've got an anxiety." And it's just like, "Oh, you've got anxiety." It was like, "Yeah, I didn't count the money right last night, and so I'm just have anxiety that I'm gonna get caught." And I'm like, I'm not sure that's the same thing.
That's called stress.
that's stress, and you kind of did that to yourself.
Yeah.
You do your job.
Or the people that actually do say, "Oh, I'm depressed."
Right.
Well, you may feel badly, you may feel sad,
Sure.
you may not feel much, but depression is a diagnosis.
It is a diagnosis. Yeah.
Or do you have depression? I don't know.
Right.
Let's talk more.
Right. I mean, and you know what? Like 20 years ago, it was okay to casually say certain words.
Yes.
And people get mad that we're taking these words away from them. But guess what? You shouldn't say the R word or the F word, or you know what? These words,
N-word.
the N word.
Yep.
That's really okay that the culture is changing.
Yes.
And we're American. So we have this wonderful pleasure. We can just make up words, and all of a sudden they just make sense. So,
Yeah. Every
so-
year they do a tally of, words that have finally made it,
yeah.
into
Well,
the culture.
You see, I found that I was often, and I think this is my culture, my upbringing a little bit too, as far as saturated in just my friends and my peer group, we always said when things were really just a lot going on, I would always be like, oh, what a crazy day. But it really wasn't. It's just, it's an intense day, and that's more descriptive. So anyway, we could talk about this. I'm probably maybe have you back on to the show. We can talk about words and the power of words, because you are the perfect person. You call me out more than most people do, which is really good. So one thing that I kind of want to leave us on a little bit is, what are some things that you think that we can do and our listeners can do to improve the mental health survival of us here in this area or the world? What are some things that we can do?
The world, okay.
Right. I mean, so we've got stigma,
Yes.
lessen our stigma,
Lessen our
educate
stigma.
ourselves about terms and also resources.
And talk. Make it part of our everyday language. Don't avoid it, like veering to the left or veering to the right, or no,
Right.
it's there. Let's just talk about it.
Right.
You know.
Like how casual it is, like, how you doing today? You're
not
expecting,
doing well.
right, but you're expecting someone to say, good.
Sometimes
That's an opportunity.
it is an opportunity. If you stop and you really are waiting for the answer, that's a throw. How you doing? And we keep walking. It's a
Right.
throwaway.
It is.
A true person actively listening, how are you doing today, Nick? I'm waiting for your answer. I'm going to sit here and we can have a conversation about it. Otherwise, I should just say hi
Right.
and keep walking.
Or like, have a great day.
Exactly.
Something like that.
But if I ask you how you're doing, I should be willing to wait.
Right. I am the thorn in a lot of my friends' side, and also staff members of mine. Every once in a while, I'll be like, oh, how are you today? I'll be like, ugh. And I'll just talk about what exactly is going on at that moment. Yeah. And it's usually not a complaint. It's just more of like, this is what I'm dealing with right now. And you can see in the face of the person that you're talking with that they did not want more than a one-word reply.
The eyes glaze over.
Right?
It's like, oh, brother, I didn't mean to ask this question.
But maybe checking in with people regularly
Yes.
and intentionally wanting to know how they are doing is a good thing.
Yes,
And
having that intention. Yeah,
That's great.
definitely.
That's
Because
great.
that's the connectedness of human beings.
That's wonderful. I agree. We're supposed to be. We're a weird creature. Us
We're
humans.
social animals.
We are social, and we exhibit illness in strange ways. But there are answers to that, and
Yes.
our culture needs to change to accommodate people's needs. And I think that will make the world a better place. I also think that if you just to throw out there what we can do, just to kind of throw it out there, let me know what you think about that. Get involved. But getting involved does not necessarily mean you have to go anywhere necessarily or be a part of a group. That would be awesome if you did. But sometimes getting involved is just as much as sending somebody a message on Facebook, or
Right.
just calling into a radio program or promoting some positive mental health out there. You never know what the reaction is going to be, but putting goodness out there usually comes back to you in a good way. Wouldn't you think?
Multifold.
Perfect.
Yes.
All right, Bonnie, I'd like to thank you for joining me today.
welcome.
And I think we should do a show about words someday soon. So so stay tuned for that. And if you have any questions for Bonnie, feel free to comment on the Mental Health Survival Guide's Facebook page, and I will forward any questions on over to her. You can also comment on the North Volume Media website, or you can send me an email. My email is nick@nami-cv.org. That's nick@nami-cv.org. And Bonnie, it's great having you here.
Thank you for having me.
All right. Y'all take care of each other and take care of yourselves, because we know that survival is so much more than staying alive.
This has been a North Volume Network podcast, the only podcast network in the North Country. Check out our full lineup on Apple Podcasts, Google Play, or northvolume.com.